Sleep apnea is a disorder that is a closing of the air passageway during sleep.
What happens is when we go to sleep at night, the muscles and complex of muscles in the throat area tend to relax and they can close off or occlude the airway. And when that happens, we're not getting oxygen to the important organs within our body that we need to live, like our brain and our heart. And if that happens, it can create a number of side effects that are quite substantial. Of course, death is one of them, but in addition, diseases like diabetes, heart disease, stroke.
High blood pressure, heartburn. Daytime sleepiness is the most common complaint due to the frequent awakenings that occur during the night when people can't breathe. But the awakenings are so brief, maybe 3 to 5 seconds, that they don't register on the conscious memory, but they are in fact occurring, and that's what causes the symptom of daytime sleepiness or fatigue.
What we can do for patients as dentists is provide oral appliances that do several things, but the most important thing is they advance the mandible or lower jaw forward, and in doing so, open up the airway. And if the airway is open, we won't have any oxygen deprivation as we sleep. If we can continuously keep that airway open, someone would not have sleep apnea.
So for people that have specifically positional types of sleep disorder breathing, that is, it's worse when they're on their back, that would indicate that gravity is pulling the tongue back. These people do better with a dental appliance. Some people have sleep disordered breathing where it's most common in certain body positions or certain stages of sleep. Dental appliances tend to work very well in those cases too, because stages of sleep may predict muscle tone and movement of the tongue, and therefore dental devices may be very, very effective.
When someone feels they have sleep apnea or any sleep disorder, it's important that they see a medical physician first and have a sleep study done. After the sleep study is performed, they're referred to our practice where we can begin the process of seeing if they are indeed a candidate for an oral appliance. Not every patient is ideal candidate for an oral appliance. In some cases, CPAP devices should be used alternatively. But we're going to do a comprehensive exam here to determine if it's the right fit for you. If it is, we'll proceed with identifying anything we need to look at to make sure we make the best fitting and most comfortable oral appliance dependent upon your type of sleep apnea.
It's more than just the device. It's actually the right device for the right mouth, the right condition. There's a variety of types depending on your situation.
Millimeters have an impact on how effective the actual sleep appliance is. So being able to make those adjustments and having the knowledge around which ones are going to make a difference, combined with having a dialogue with my existing doctor that helped diagnose me with sleep apnea was important to me.
It's well worth it. The results I'm getting after getting fitted with the appliance, I've been very, very happy with it. It's night and day, and I can turn and sleep any direction I want. It's great. It's really a bit of freedom again.
There are over 25 million Americans that suffer from sleep apnea, and 19 million of those patients are undiagnosed. If you feel like you may have sleep apnea, if you feel unrested after a full 8 hours of sleep at night, if you have any daytime sleepiness, or just feel tired, or your sleeping partner tells you that you're snoring, I think it's important that you consider coming in for a free complimentary consultation with me. I'm happy to help diagnose and refer you to a sleep study or sleep physician so we can get you taken care of. We'd love to see you and hope we can help you soon.